Cystocentesis allows for the collection of sterile urine samples and is typically a painless procedure. Because the aorta and vena cava lie dorsal to the urinary bladder, it is important to be familiar with anatomy, use the shortest needle possible, and position the animal in lateral recumbency if possible to avoid puncturing these vessels. Cystocentesis may also be performed in dorsal recumbency, especially if an ultrasound probe is available. You will need alcohol, a 3 to 6 milliliter sterile syringe, and a 22-gauge needle in 3/4 inch, 1 inch, or 1.5 inch length. A 3/4 to 1 inch needle is appropriate for cats and smaller dogs, while a 1.5 inch needle is reserved for larger dogs or animals with excess abdominal fat. If able, palpate the caudal ventral abdomen to isolate the bladder. It should feel similar to a water balloon. Apply alcohol to the fur in the approximate location of the bladder. If not using an ultrasound probe, use your gloved non-dominant hand to isolate the bladder and use your dominant hand to collect the urine sample. Wearing gloves will help to avoid contaminating the site. If using an ultrasound probe, locate the bladder with the probe. If using an ultrasound, apply alcohol to the caudal ventral abdomen. Using your non-dominant hand, place the ultrasound probe about halfway between the pelvis and umbilicus, applying gentle pressure to the body. When you are able to visualize the bladder clearly on the monitor, one hand continues to hold the probe to the body while the other hand manipulates the syringe. With the needle attached to the syringe, insert the needle through the abdominal wall in a dorsal caudal direction into the bladder. Aspirate slowly to fill the syringe with urine. Once the syringe is full, stop applying negative pressure to the plunger. Hold the plunger in place and remove the syringe from the body. Remove the syringe from the needle and place a new sterile needle on the syringe filled with urine. Transfer the sample into a sterile urine vacutainer tube. Note, if upon aspiration no urine fills the syringe, withdraw the needle from the patient and reattempt. The needle should never be redirected while in the patient.